Every home has a story, and in every story, there's a home. It is about you, your relationships, your family. This is the home of your stories. Give your relationships an opportunity to grow and make them beautiful. For you and your near and dear ones, LIC Housing Finance makes a humble request. Stay home. Stay safe.
Hyderabad, popularly known as the City of Nawabs, located in southeastern part of India, is famous for its rich cultural legacy. A prominent attraction of this modern yet historically and culturally rich city is the traditional Hyderabadi bangle. They are not just symbols of matrimony and accessories for women, but are objects of beauty in themselves. Ask any Hyderabadi and they will definitely say so.
हमने ऐसी चूड़ियाँ कहीं भी नहीं देखी। ऐसी चूड़ियाँ हमें यहाँ देखने को मिलती है और इसकी प्राइस भी एकदम रिजनेबल है।
Cluster containment strategies and action plans for outbreaks which are amenable to management, yielding positive results in some areas like Agra, Gautam Budh Nagar, Bhilwara, East Delhi and Mumbai. Union Home Minister Amit Shah directs authorities to take appropriate steps in coordination with state governments to prevent hoarding and black marketing of commodities to contain the spread of novel coronavirus. Group of ministers meets at Defence Minister Rajnath Singh's residence to discuss a strategy in the wake of COVID-19 situation. Group of ministers have been conducting regular meetings to coordinate response to the pandemic. Government lifts restrictions on export of select COVID-19 related pharma products. MEA says the decision taken only after confirming the availability of medicines for all possible contingencies, paracetamol and hydroxychloroquine, to remain in licensed category and continuous monitoring to take place. Number of active corona cases in India rise to 3,981, while 326 persons have recovered and have been discharged. 117 deaths have been reported. State governments taking quick steps to contain COVID-19. Uttar Pradesh government talks of setting up Corona Sample Collection Center in every district headquarter. Madhya Pradesh government announces insurance of 50 lakh rupees to cops and employees of the state government engaged in containment of the pandemic in the state. Confirmed COVID-19 cases across the globe crossed 13 lakh mark with nearly 76,000 fatalities. Japan declares a state of emergency in Tokyo and 6 other parts of the country to combat coronavirus. UK PM Boris Johnson in ICU as symptoms worsen. Hello and welcome. You're watching DD India and DD News with me, Munmu Bhattacharya. Let's get started with our top story, which is that guidelines or action plans have already been issued by the Union Health Ministry for cluster containment and outbreak containment, and they are yielding good results in districts of Agra, Gautam Budh Nagar, Pathanamthitta in Kerala, Bhilwara, East Delhi and Mumbai as well.
कोरोना को मैनेज करने के लिए गवर्नमेंट ऑफ इंडिया की तरफ से ऑलरेडी क्लस्टर कंटेनमेंट स्ट्रैटेजी और साथ ही आउटब्रेक विच इज़ एमिनेबल टू मैनेजमेंट उससे रिलेटेड स्ट्रैटेजी एक्शन प्लान हम लोगों ने स्टेट को और डिस्ट्रिक्ट के सारे डीसीज को भी ओरिएंट किया था। उसके तहत इट इज़ सो हैप्पी टू नोट कि हमें कुछ स्थानों पर उसके रिक्वायर्ड रिजल्ट्स भी आ रहे हैं।
Under the Smart City concept, control rooms and technology are being used for COVID-19 management at district levels like in Pune, Bengaluru, Surat and Tumkuru. Surveillance and monitoring of quarantine facilities, tracking of health of suspected patients and their contacts, management of those staying in home quarantine, keeping citizens updated with information, predictive analysis using heat maps, real-time tracking of ambulances and training of doctors, healthcare professionals, telecounseling with the use of technology are taking place.
कहीं जगह पर स्मार्ट सिटी कॉन्सेप्ट के तहत जो हमारे कंट्रोल रूम चल रहे हैं उनको भी और टेक्नोलॉजी को यूज़ कर कोविड-19 का मैनेजमेंट ये एक्सरसाइज भी हर जिले लेवल पर चल रही है। जैसे कि पुणे, सूरत, बेंगलुरु और तुमकुर डिस्ट्रिक्ट में टेक्नोलॉजी को यूज़ कर सर्वेलेंस, क्वारंटाइन फैसिलिटीज़ मॉनिटरिंग, ट्रैकिंग द हेल्थ ऑफ सस्पेक्टेड पेशेंट्स और उनके कॉन्टैक्ट्स, people who are staying at home quarantine unka management, informing citizens with respect to up-to-date information, साथ ही predictive analysis using heat maps, real-time tracking of ambulances और training of doctors, healthcare professionals, साथ ही telecounseling भी टेक्नोलॉजी को यूज कर की जा रही है।
The Joint Secretary in the Health Ministry, Love Agarwal, said that no decision has been taken on extending the lockdown. He has asked media not to speculate on the issue.
ऑनरेबल सुप्रीम कोर्ट ने इससे पहले भी क्लियरली आदेश दिए हैं कि जब तक कोई ऑथेंटिक इंफॉर्मेशन ना हो तो पब्लिक में कंफ्यूजन, भय की परिस्थिति उत्पन्न होने के चांसेस हैं। जो भी कोई डिसीजन लिया जाएगा बेस्ड ऑन द अवेलेबल फैक्ट्स वी विल डेफिनेटली ब्रिंग इट योर नोटिस एंड टिल दैट टाइम ए डिसीजन इज नॉट ऑफिशियली कम्युनिकेटेड, जब तक हम आपको ऑफिशियली कोई कम्युनिकेट ना करें तो आप काइंडली उस पर स्पेकुलेट ना करें।
The Union Health Ministry is working in close coordination with the Ministry of Pharmaceuticals regarding the national requirements for hydroxychloroquine, as well as proper matching has been done in this regard. The government said that there is required quantities that are available. Let's move on now. India will license paracetamol and hydroxychloroquine in appropriate quantities to all neighbouring countries who are dependent on the country's capabilities. Responding to media queries, External Affairs Ministry spokesperson Anurag Srivastava said that the decision has been taken in view of the humanitarian aspects of COVID-19 pandemic. He said that India will also be supplying these essential drugs to some nations which have been particularly badly affected by the pandemic. He added that there should not be any speculation or attempt to politicize the matter. MEA spokesperson further said that DGFT has notified lifting of restrictions on 14 drugs yesterday. He said that paracetamol and hydroxychloroquine will be kept in a licensed category and their demand position would be continuously monitored. Besides that, he assured that the first obligation is to ensure that there are adequate stocks of medicines for the requirement of India's own people. In order to ensure this, some temporary steps are taken to restrict exports of a number of pharmaceutical products. Anurag Srivastava said that these restrictions have been largely lifted after having been confirmed the availability of medicines for all possible contingencies currently envisaged. Raksha Mantri Rajnath Singh chaired a GOM meeting to devise a strategy to counter COVID-19 induced lockdown in the country. Home Minister Amit Shah, Minister of Information and Broadcasting Prakash Javadekar and others were present at the meeting. Prime Minister Narendra Modi has wished well for all on World Health Day. In a tweet, he said that today on World Health Day, let us not only pray for each other's good health and well-being, but also reaffirm our gratitude towards all those doctors, nurses, medical staff and healthcare workers who are bravely leading the battle against the COVID-19 menace. This World Health Day, let us also ensure we follow practices like social distancing, which will protect our own lives as well as the lives of others. May this day also inspire us towards focusing on personal fitness through the year, which would help improve our overall health. Status of essential goods and services is by and large satisfactory, and the Union Home Minister did a detailed review of the status of essential commodities and lockdown measures, and he's given directions to take appropriate measures and ensure hoarding and black marketing do not take place.
लॉकडाउन मेजर्स को इम्प्लीमेंट करने के लिए सबका सहयोग आवश्यक है। आने वाले सप्ताह में कई त्योहार हैं। इस संदर्भ में कई कम्युनिटी लीडर्स भी आगे आए हैं। उन्होंने कम्युनिटीज़ को आग्रह किया है और कर रहे हैं कि वे लॉकडाउन के स्ट्रिक्ट इम्प्लीमेंटेशन में सरकार का सहयोग दें। गृह मंत्री जी ने एसेंशियल कमोडिटीज़ और लॉकडाउन मेजर्स के स्टेटस का डिटेल्ड रिव्यू किया। उन्होंने निर्देश दिया है कि उपयुक्त कदम उठाए जाएं और राज्य सरकारों के साथ मिलकर सुनिश्चित किया जाए कि कहीं भी होर्डिंग और ब्लैक मार्केटिंग ना हो। ऐसा करने वालों के विरुद्ध सख्ती से और त्वरित गति से कार्रवाई हो।
Delhi Chief Minister Arvind Kejriwal today briefed the media over coronavirus. He said that the Delhi government has prepared a 5-point action plan to contain the spread of coronavirus in the city. Let's listen in.
पहला टी है टेस्टिंग। हमने ये देखा कि जिन जिन देशों ने टेस्टिंग नहीं की, वो जब कोरोना फैल गया तो उसको कोरोना को नियंत्रित नहीं कर पाए। दूसरा हमारा टी है, दूसरी बिंदु है ट्रेसिंग। हमारा तीसरा टी है ट्रीटमेंट। चौथा टी हमारा है टीम वर्क। आज सारी सरकारें एक टीम की तरह काम कर रही हैं, राजनीति से ऊपर उठ के। और पांचवा टी है ट्रैकिंग एंड मॉनिटरिंग।
The Delhi Chief Minister also said that the government has traced 2,000 numbers of the Markaz members. He added that in the follow-up, affected areas will be sealed and locked down.
ये भी पता कर रहे हैं कि मरकज के जो लोग निकले थे, लगभग 2,000 फोन नंबर आज हम पुलिस को देने वाले हैं कि मरकज के अंदर जितने लोग थे वो कहीं आसपास बाहर के एरिया में तो नहीं घूमे थे। अगर वो बाहर के एरिया में घूमे थे और वो कहाँ कहाँ गए थे वो पता चलेगा तो उन एरियाज को सील कर दिया जाएगा। तो ट्रेसिंग के बेसिस पे हम सेल्फ क्वारंटाइन करेंगे, सीलिंग करेंगे और मॉनिटरिंग करेंगे कि लोग सेल्फ क्वारंटाइन फॉलो कर रहे हैं कि नहीं कर रहे।
Uttar Pradesh Chief Minister Yogi Adityanath has said that UP COVID Care Fund will be used for strengthening of the healthcare system, including establishing more testing facilities and COVID-19 hospitals. He added that currently 10 testing labs are functional across the state.
कोविड-19 के खिलाफ प्रदेश सरकार ने उत्तर प्रदेश कोविड केयर फंड की स्थापना की है। कोविड केयर फंड का उपयोग हम प्रदेश के अंदर टेस्टिंग फैसिलिटी को बढ़ाने में इसका उपयोग करेंगे। कोविड लेवल 1, लेवल 2, लेवल 3 के हॉस्पिटल की संख्या को बढ़ाने में इसका उपयोग करेंगे। कोरोना के खिलाफ जिन सहायक उपकरणों की आवश्यकता है, थर्मल एनालाइज़र, इन सब के वेंटिलेटर्स, इन सब के मैन्युफैक्चरिंग की प्रक्रिया को भी और आगे बढ़ाने की कार्रवाई के साथ प्रदेश सरकार निरंतर कार्य कर रही है। भारत सरकार के सहयोग से हम लोगों ने अब तक कोरोना टेस्टिंग के 10 लैब्स प्रदेश के अंदर स्थापित किए हैं।
In a stern warning to rumour mongers on social media platforms, Gujarat Chief Minister Vijay Rupani has said that strict action will be taken against those who misuse the social media platforms and spread rumours.
जो अफवाहें फैलाते हैं और सोशल मीडिया का भी दुरुपयोग करते हैं, उसको हम नहीं छोड़ेंगे। इसी वक्त, इसी समय ये बहुत नुकसान करता है, तो इसके सामने कड़े से कड़े कदम हम लोग कर रहे हैं और ऐसे लोगों को भी हमने गिरफ्तार भी किया है, उस पर मुकदमा भी हमने दर्ज किया है।
The electric loco shed in Bhusawal Central Railways has developed an in-house disinfectant tunnel to fight COVID-19 in a time span of 2 days, with a view to keep employees protected who are still coming to shed even in these difficult times. The disinfection tunnel can disinfect a person fully from head to toe in a time span of just 3 seconds, and the solution used is completely harmless. The total cost of the tunnel is approximately 15,000 rupees and can screen one person at a time. At a time when there is high demand for masks but availability of such masks is less, some self-help groups have pitched in by making such masks catering to high demand. Our correspondent Sudipta Kar has filed a special report from Tripura.
There are many warriors in this COVID-19 fight. Some faces we know and some faces we don't know. Some are there who are making face covers for these known and unknown faces. These people who are making face covers or face masks are also warriors in this COVID-19 fight.
अभी हम लोग 200 मिनिमम 200 तक हम लोग दिया मार्क्स बना के सर WHO का सर हम लोग का एक मार्क्स का नमूना दिया सर वो सर ने बोला हम एक नमूना हमको भेजो फिर हम आपको बनाने के लिए बोलेंगे तो हम लोग एक सैंपल दे दिया सर सर ने वो बोला हाँ ठीक है अभी बना सकती है आप लोग.
हमने ये डिसाइड किया कि अगरतला पूर्व निगम की तरफ से जितने हमारे सेल्फ हेल्प ग्रुप हैं उसमें से जो लोग भी टेलरिंग का काम कर सकते हैं या करते हैं उन लोगों को हमने इकट्ठा किया, उनको एक दिन ट्रेनिंग दी गई और उन सबको हमने अपनी तरफ से 100% कॉटन का कपड़ा दिया है और उन लोगों से हमने बोला है कि आप लोग इस पर मास्क बनाइए. ये सारे मास्क सेम साइज़, सेम शेप और सेम स्पेसिफिकेशन के हैं और ये अलग अलग कलर के बना रहे हैं, सफ़ेद, फिर नीला, फिर हरा और पिंक कलर का भी बना रहे हैं, जो भी मार्केट में कपड़ा अवेलेबल है. कपड़ा इसके लिए अभी तक हम लोगों को 60 रोल अलग अलग NGOs, प्राइवेट लोगों ने हमें ये डोनेट किया है. 15 सेल्फ हेल्प ग्रुप अगरतला में ये मास्क बना रहे हैं और रोज़ डेली बेसिस पे एटलीस्ट 600 बन रहे हैं. हमने टारगेट दिया है कि डेली बेसिस पे 1000 बनाने का.
Good quality masks made of cotton, 3-layer masks as suggested by health department. 2-layer mask and 100% cotton, and it can be reused like say next day you wash it and iron it and wear it again. It will give you, though it won't give you 100% protection, but it will give at least 70 to 75% protection it will give.
As per recommendation of WHO, SCG members in Tripura are making masks, 3-layer masks for the different warriors. They may not be knowing for whom they are making, but they are making effort to make India COVID free. This is an initiative and they said we shall overcome this COVID-19. With camera person Shubhrata Shah, this is Sudipta Kaur, DD News, Agartala.
Better management of vegetable chain supply in Aizawl in Mizoram is taking place, where a meeting was held yesterday under the chairmanship of Commerce and Industries Director Pujay Himenthas Ola, and that was attended by HODs and officials of aligned departments, wherein better management of bringing in domestic vegetables from the village side and sale of the same within Aizawl city during the lockdown period was discussed. In the meeting, it was decided to divide Aizawl into 12 zones, each headed by a zonal officer who will coordinate with the local task forces in supplying vegetables to the respective zones. The zonal officer will man the controlling rooms in each zone and submit their reports to their controlling officers. The controlling officers in turn will supervise 3 zones each. Also, vegetables imported from outside the state will be first examined by the COVID-19 medical operational teams. All fruits and vegetables will be sold within the state at no profit, no loss rates. In what could be a positive response at a time when Nagaland is facing an acute shortage of face masks due to the outbreak of COVID-19 pandemic, the government polytechnic Kohima has come up with mass production of the face masks as well as protective personal equipment suits and disposable bed sheets. Even as India's health professionals wage a valiant battle against novel coronavirus, it has inspired the country's technocrats to also lend their skills to the cause. In Coimbatore, Tamil Nadu, engineers at an incubator run by the Atal Incubation Center, backed by Niti Aayog, are doing their bit to aid the fight against the virus. Using inputs from local doctors, the design was further refined to suit safety requirements. The advantage of the design, the makers say, is that it covers the entire face and can be reused after cleaning with soap. The first 250 shields were given free of cost to the Government Medical College Hospital, an ESI hospital in Coimbatore, and 100 to sanitation workers of the city corporation. At a time when such products are in great demand, its creators believe they have winners on their hands. Prime Minister Narendra Modi today had a telephonic conversation with Prime Minister of Sweden, Stefan Löfven. The two leaders discussed the ongoing COVID-19 pandemic and the steps being taken in their countries for controlling its health and economic impact. Mr. Modi and Mr. Löfven also agreed on the potential for collaboration and data sharing between Indian and Swedish researchers and scientists, which would also contribute to the global efforts against COVID-19. The former video editor of DD News, Tulsi Ram, passed away today. DD News family pays its condolences to the members of his family. He was a former video editor of DD News and he's passed away. The entire Doordarshan family pays condolences to his family members. This is an irreparable loss for Doordarshan as a whole. Well, moving on now to some international news. Japanese Prime Minister Shinzo Abe today declared a state of emergency to fight coronavirus infections in major population centers and unveiled a stimulus package that he described as among the world's biggest to soften the economic blow. Abe announced the state of emergency targeting the capital Tokyo and 6 other prefectures, accounting for about 44% of Japan's population for a period of about 1 month. His cabinet will also finalize the stimulus package worth 108 trillion yen, equal to 20% of Japan's economic output, to cushion the impact of the epidemic on the world's third largest economy. Prime Minister Narendra Modi today spoke to Sultan of Oman, Haitham bin Tariq. The two leaders discussed the health and economic challenges posed by the ongoing COVID-19 pandemic and the steps being taken by their countries to respond to it. They agreed that both countries would extend all possible support to each other in dealing with the crisis. The Sultan of Oman assured Mr. Modi about the safety and well-being of the Indian community in Oman in the present situation. He also thanked the Prime Minister for the recent support provided by the Government of India to Omani citizens in India. Prime Minister reiterated his condolences for the demise of Sultan Qaboos. He conveyed his best wishes for Sultan Haitham's reign and for the peace and prosperity of the people of Oman. He stressed that India regards Oman as a very important part of its extended neighborhood. In such critical times, it's required that we stay away from any fake news circulating on the internet or social media. In order to stop the spread of fake news, Ministry of Home Affairs has urged people to use or share information from verified, credible sources only. For any government policies or schemes, they should refer to PIB Twitter. It said that spreading of fake news is punishable by law. Therefore, if people come across any fake news on social media platforms, they should report it to www.cybercrime.gov.in. Well, the nation has been responding positively to Prime Minister's call to donate to the PM Cares Fund to tide over the COVID-19 crisis. However, some anti-social elements have been trying to misappropriate the forum by creating fake UPI IDs, trying to dupe people. It has been informed that only the correct UPI ID for donating to the PM Cares Fund is pmcares@SBI, and only that should be used. All the other similar looking IDs are fake, and the people are advised to beware of such fake UPI IDs. Further rubbishing reports being circulated on WhatsApp claiming that the police can take action against the group admins if there are jokes posted on coronavirus. PIB in its Twitter account has informed that there has been no advisory or order issued by the government. Another fake news doing the rounds is that the Indian Embassy in Brazil is collecting information of Indians stuck in Brazil. The PIB has stated that these are absolutely false claims. We'll head into a break at this point in time. Lot more news up ahead. Stay tuned.
ये वाला भी.
And this one?
हाँ. मैम.
How will I pay?
मैम योर रिसीट. ये कैसे?
खुशियों के रिमोट कंट्रोल से बैंक ऑफ बड़ौदा का इंटरनेट बैंकिंग दे हर पॉज से छुटकारा. लॉग इन, चूज पेमेंट ऑप्शन, मेक पेमेंट, गेट कंफर्मेशन. बैंक ऑफ बड़ौदा.
पक्की होगी बुनियादें तो हंसे हिंदुस्तान होगा. पहले करो शुरुआत करो, करो तो पक्की बात करो. पहले करो शुरुआत करो, करो तो पक्की.
वंडर सीमेंट, एक परफेक्ट शुरुआत. Every home has a story, and in every story, there's a home. It is about you, your relationships, your family. This is the home of your stories. Give your relationships an opportunity to grow and make them beautiful. For you and your near and dear ones, LIC Housing Finance makes a humble request. Stay home. Stay safe.
125 करोड़ से ज्यादा आबादी का देश, तो लगभग इतनी ही जेबें भी होंगी, पर एक वीआईपी नंबर है जो लगभग हर एक जेब में पाया जाता है. उसे दिखाओ तो बैंक में खाते खुल जाते हैं आसानी से. अपने हक के पैसे सीधे खातों में आ जाते हैं आसानी से. बैंक हमारे दरवाजे तक पहुंच जाता है. इनकम टैक्स वेरिफिकेशन भी हो जाता है आसानी से. इसीलिए कहते हैं भैया,
आधार अपना लो,
फायदे में रहोगे.
Welcome back. Haryana Chief Minister Manohar Lal Khattar has said that wheat procurement will be done in a graded manner slowly and gradually as the state battles the COVID-19 pandemic.
अब ये जो क्रूशियल टाइम है, सामान्य दिनों की प्रकार जैसा पहले प्रोक्योरमेंट होती थी उस प्रकार तो शायद हम नहीं कर पाएंगे, लेकिन सोशल डिस्टेंसिंग का जो एक मंत्र है उसको ध्यान में रखते हुए ये थोड़े थोड़े मात्रा में लंबे दिनों तक करने की एक योजना बनाई है. पिछले बार गेहूं की प्रोक्योरमेंट के लिए 477 मंडियां और परचेज सेंटर ये सब पूरे प्रदेश में बने हुए थे, लेकिन इस बार योजना बना करके हमने उसको थोड़ी थोड़ी मात्रा में हर जगह पर गेहूं आए, इसलिए संख्या बढ़ाकर लगभग 2000 ये सब मंडियां और परचेज सेंटर्स ये रहेंगे.
And that's it today. And this edition of the news and updates will continue on DD News and DD India.
Every home has a story, and in every story, there's a home. It is about you, your relationships, your family. This is the home of your stories. Give your relationships an opportunity to grow and make them beautiful. For you and your near and dear ones, LIC Housing Finance makes a humble request. Stay home. Stay safe.
At a time when the nation is unitedly combating COVID-19, the medical fraternity is at the forefront of this fight. They are putting their own lives at risk to save the lives of others. So how challenging are these times for the medical fraternity, and what do we as a nation and as individuals need to do to keep ourselves safe and healthy? To talk about all that and more, we have with us Director AIIMS Delhi, Dr. Randeep Guleria. We are at his residence on the AIIMS campus. Welcome, Dr. Guleria, to DD India.
Thank you.
I saw a placard on Twitter. It was held by a doctor and it read, "I stay at work for you, you stay at home for me." That's powerful messaging. On the day of the Janata curfew, we saw how the entire nation saluted the selfless service being rendered by health professionals. The Prime Minister, the Health Minister have underscored the dedication of people like you who are part of the health fraternity. Are these challenging times for the medical fraternity, and is it also an opportunity for you to learn and prepare for the future?
So both these are challenging times for the health fraternity, because this is a time when the health system is being challenged. The healthcare workers are at the front line about a disease that they are scared about, they don't know that much about it, and they are worried about their own lives and the lives of their dear ones. It's also something that is a process of learning, because this is an outbreak which is unprecedented in history, or in our lifetime at least, and preparing for it and preparing for the future, building up our health resources in a short span of time, and how do we cope in this moment of crisis is something that we're all learning every day.
India is currently in lockdown for 21 days. How crucial are these 21 days in this fight against COVID-19, and what's the logic behind 21 days per se?
So first of all, it's important to understand that this is a disease which is through human to human spread. What that means is that if we have to break the chain of transmission, we have to stop this human to human spread, and that means spreading from one individual to the other, which can occur only through social contact, coming closer, or being in a crowd where we have a large number of cases. If we are able to have a total lockdown and individuals stay at home and follow it sincerely, then this will stop. The virus has an incubation period of about 14 days, and if we allow 14 days of total lockdown and we give another week, so that in case there is someone who has a little bit of a prolonged incubation period, we will be able to prevent that transmission to another individual during that incubation period. Having said that, it's important to understand that as it goes from one person to the other,